investment is far less than curative. Okay, so when you have that problem with investing into promotive and preventive, thus equal to less awareness.
Greetings, Dr. Muhaimin. Thank you
Greetings,
for taking
Alicia.
your time to join us today in light for the Selangor Life Sciences Convention Synergy Conference. So to begin, holistic healthcare combines preventive and personalized care. Could you share some successful examples of this approach in Malaysia?
Thank you, Alicia, for inviting me into this interviews and this convention and conference. With regards to your question, I would say that I cannot name any, because a holistic healthcare solution or any organization that renders this service is actually, might say, none, because a lot of these entities or these organizations are focused into a very specific care. For example, like hospital care, or maybe hospital with acute primary care. We can see that there is a movement towards a more holistic, in which include promotive, preventive, but it is still immature, I could say, in our market compared to somewhere outside Malaysia.
Thank you for the insight. So moving on, you've worked extensively with Protect Health. So what are some of the strategies you believe will help this healthcare accessibility and its affordability for all Malaysians?
The key here is actually the benefit package and the payment mechanism. So Malaysia currently practices implicit benefit package. What I mean implicit is there is none written in any document that what are we Malaysian entitled in healthcare services. You can try your luck in if you have cancer in our government hospital, and they can say that, or you can this type of treatment, but this type of treatment you cannot, because we don't have the budget to cover for your treatment. So this benefit package should be more explicit, means this very essential benefit package should be more explicit to the people, so that we as a people of Malaysia know what we are entitled to. Number one. Number two is the payment mechanism. We should move more towards a very quality based or quality value based payment, in which currently we are practicing more towards fee for service payment mechanism, in which it already shows the impact of inflation in medical healthcare. So with this inflation, it causes more inequitability, inequitness of access to healthcare.
Right, so these strategies can help to a bit improve accessibilities in the future.
Yes.
So moving on, Protect Health has been tasked with providing health screenings for B40s. So how can you progress to implement a holistic healthcare solution for them?
So like I mentioned in my presentation just now, we are currently already start a project of hospital services outsourcing program. Our PKB40 is on screening. Our scheme Perubatan Madani is on primary acute care. We aspire and we are always pushing towards a more to complete the holisticness, in which we are pushing for NCD treatment. So PKB40 is only for screening. So screening of NCDs only happens there, but if the patient is having risk or already have been diagnosed with NCD diseases, they are referred back to KKM Klinik Kesihatan KKM, in which crowded more the MOH clinics. Now we are trying to move into NCD treatment, in which we are hoping that the patient we diagnose with NCDs can be treated at the private centers, not just in MOH centers. So this can decongest and also reduce the waiting times in klinik kesihatan in government settings, and also expand the access to more healthcare services out there. in which are more, our primary healthcare facilities is actually more towards the private side rather than MOH side.
Right, so understood. You and your team's work in Protect Health is very inspiring.
Thank
So
you.
moving on, preventive care is the key to holistic health. So how can Malaysia foster a stronger culture of preventive healthcare at both individual and community levels?
So currently Malaysia are quite lagging behind promotive and preventive. This is due to we are very much focused on curing or treating illnesses rather than preventing them. So if you can see, I don't have data with me, but I can assure you that the promotive and preventive investment is far less than curative. Okay, so when you have that problem with investing into promotive and preventive, thus equal to less awareness and less education for health for our Malaysian. So actually we are moving towards there, but yeah, we are lagging. I can surely say that, but we already, one of the steps that I can be proud to say is the behavioral economics or behavioral insights, in which we tackle most of this unhealthy lifestyle. It's actually individual and community based, like you said, how we can level at community or individual. Behavioral insights or behavioral economics can help intervene behavioral intervention to this community and level at the level of individual even. So our approach previously is always educating awareness, but we never empower, or we change the architecture of options for healthy products or healthier lifestyles. So I believe we already moving towards there, and Malaysia is one of WHO country for behavioral insights. I believe, and we at ProtectHealth also are supporters of promotive and preventive care. Actually, one part of the PKB40 is also we want to expand into wellness and preventive care, in which includes wellness and stop smoking, prevention of diseases care.
Right, so thank you for that great insight. So now holistic healthcare involves collaboration around different sectors. So what role do you think technology will play in enhancing collaboration between healthcare providers, policymakers, and the public?
It's a huge role that the digital technology can do for health, for holistic healthcare solution, or even promoting and preventive. First of all, in Malaysia, we don't have any, I could say, very accurate to the level of individual level data. They say this person health status or risk factors. We only have National Health and Mobility Survey, in which it is a survey. But if I may take an example, for example, in Korea or in Taiwan, they have one big data that is every health of a person in that country from womb until to tomb. They have the all risks there. So when you do an analysis, you can see that this targeted area, for example, we can say if in KL, maybe in KL they have a lot of people having lung diseases or maybe lung problems, in which we can deep dive into it, seeing why. When we see why, then we know maybe it is due to the quality of air. And when we see that it is due to quality of air, we can start negotiate or start collaborating with the relevant parties, like relevant ministries or even local authorities, to set a policy that is more helping towards that community in KL, for example. So that's what happened in Taiwan, in Korea during COVID, when they can put a stratification of risk of people that will get COVID-19 that time. So they can put some alarming colors like red, yellow, or green zones. So they know that beyond these zones, these people are safe. But this zone, they are more riskier. So the effort should be more towards the riskier level rather than the green zone. So unfortunately, our data is like segregated, and also most of it is not digitalized. So moving towards a digitalization and big data analytics is very, very crucial to a very comprehensive holistic solution, holistic healthcare solution. Yeah.
So I'm pretty sure we all know that digital health does improve and plays
Yep.
a huge role in the
Yep.
healthcare industry. So moving on to our final question, Dr. Muhaimin. Looking forward, how do you envision Malaysia's healthcare system adapting to a more integration for a more holistic and personal care?
Thank you. That's a very great question. Moving forward, we need to start thinking and strategizing about procuring or implementing healthcare services. We want a more unified healthcare services or healthcare system whereby it is not dichotomy where public money goes to public sector and the private money goes only to private center. We want them to be more harmonized. This will enable more access to healthcare. This will enable more efficiency and efficacy of healthcare implementation. And also we need to move forwards to more sustainable financing of healthcare financing, in which will enable a more reformed or more holistic care for the patient. Be it like we introduce a benefit package which is a holistic healthcare, or maybe it can be something that is one entity that manage all of this all of this financing for healthcare. That's what I call a unified healthcare. Currently, our Malaysia's healthcare system is still dichotomous, and leaving it in status quo is not sustainable. And I believe that we need to move forward a more sustainable healthcare financing that inshallah will enable a more holistic care. Because with current unsustainable financing, the holistic healthcare is somewhat fading in the future.
Right, so that's a great note to end this session with. Thank you for taking your time
you.
to join us, Dr. Muhaimin.
Thank you. Thank you.